Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, attorney Kim Hegwood of Your Legacy Legal Care, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest today is Dr. Brittany Lamb. Good morning.
Hi, thanks for having me.
Oh, I am super excited to have you on the show because we're going to talk about what families need to know about hospitals and dementia. And so we have a lot of clients come through because I do elder law, and so, that have dementia. So this is going to be really good stuff to make sure that if they do have to take their loved one to the hospital, they know what to do. And it's my understanding you're an ER doctor, right?
Yep, I'm an emergency medicine physician. I've been practicing since 2014.
And so awesome. And so, but you started a company to help dementia patients and their families. And tell us a little bit about that.
Yeah, so I kept seeing people really struggle in the ER. And I didn't really want to take care of people living with dementia. I kind of avoided picking up and putting my name on those patients because I felt like I didn't know where to send them. I didn't know that I didn't feel like I was truly helping them, like they're coming from a living facility or they're coming from their home. And I felt like I was just shuffling them along within the system. And so what I realized was that I needed to learn more. I needed to educate myself. And when I was growing up, my grandmother actually lived with us when I was growing up, and she lived with vascular dementia. So I know about what it's like to live with a person living with dementia. And I feel like they're extremely vulnerable, and the decision makers, the people who are speaking on their behalf whenever they can no longer make their own medical decisions, they're not prepared usually, and they really struggle and are under so much emotional stress trying to make medical decisions in the moment. And as an ER doctor, to me, it's the medical problems that are going to happen to people are relatively foreseeable. We know what normally happens. And so in my opinion, I'm like, well, if I could have educated you a year ago that this could happen to your person, and these were the three options and how we could handle this, you could have thought ahead of time about what's okay and what's not okay. So that's what I built a business that helps people plan and learn about the medical situations that are most likely going to happen so they can make decisions that really go in line with what their person would want and what their person's values are. So
well, that's
a whole bunch of things. It's just, the healthcare system is not set up to support people who are doing this. And it's just, there's too many holes and there's lack of time. And so I saw a need, and it just makes me happy to do this work.
It's always good when you find your calling. And so most definitely. So what are the most important things that families can do to prepare for a crisis that results in a visit to the ER?
I could probably talk about this for an hour. And this is basically what I teach inside of my program. And I teach online and blog articles and my audio training that I put together for decision makers. But there's really a practical thing that people can do. And when people are going to have a baby, they have a to-go kit. They have a kind of an idea of where they're going to go, how they're going to get there, who's going to go. People need that for the emergency department and hospital stays. People living with dementia are going to come to the hospital. It's just a normal part of what happens when people are living with a disease in their brain. They're at a higher risk of coming to see us. So for practical help with that, I do recommend having a to-go kit and having this stuff already prepared and packaged for you. And not just for your person, but also for you if you're going to be going with them. So for help with that, if you go to my website, blambmd.com/to-go, it will take you to a page where you can see the whole list of things that I recommend that people kind of do ahead of time. If you click on below it, you can actually open the document and print it out. So, but that's on a practical level, what people need to do. People also need to have discussions about what living means to their person, what living well means to them, so that we can have an idea of which way we're going to go as far as their medical care goes. And that's a much bigger concept, but that's really what people need to do in order to be prepared to come to the ER and hospital and be able to speak for their person, is help the medical professionals do the right thing and know what's okay and what's not okay. And it starts with knowing what a person's value of quality of life is and what it means to them.
We talk a lot about quality of life in my practice. And so, because to me, that's really important. What kind of things are you going to want? What kind of things you're not going to want? In what circumstances, so,
Mhm.
so that's really good. So how about, let's kind of switch gears a little bit. Uh,
Yeah.
so what do you think are the most important things that, or let's talk about discussing goals of
Yeah.
care, for family members, nurses, doctors, how does all that interplay when you're hitting that emergency room, maybe for the first time?
Yeah. So a person's overall goal of care is going to give us an idea of which direction to go with their care. And I think inside of the healthcare system, this is like a topic that people don't want to talk about. And we wait so long to talk about it because for multiple reasons. One, to do it well, it takes time. Two, when you walk into a room and you see a new person, especially in the ER or the hospital, you've never met them before, you have no idea what's going on in their life and how they're going to react to you saying, okay, I really want to talk to you about your person's overall goal, right? I think a lot of times people get the perception that when we're coming at them, asking them, like, okay, what's important to your person, what's okay, what's not okay, that the medical care team I think a lot of times people feel like the medical care team is giving up on their person. Like now we're starting to talk about, is this a good idea or not? And we need to normalize these conversations from the time we basically become adults and we're taking care of ourselves in our day-to-day lives. What does living mean to us and what does living well mean? But I do want to kind of break down, if you'll allow me, just the overall goals of care so it doesn't seem like such a foreign concept. Basically, if a person, it's basically like how much medical care is okay for this person is what their goal of care is. And so there are people who their goal is to prolong their life. They want to stay alive and they're okay with sacrificing some quality of life in order to do that. So if we treat their medical problem aggressively, they may recover from that, but they may not quite get back to their baseline, or they may. Okay. So people have a goal of care of living longer. Then there are people who have a goal of care of maintaining their current like quality of life in the way that they currently live. They might not necessarily want like all medical care. And especially if the care is just going to try to keep them alive, and it's not likely that they're going to keep their current quality of life. So that's kind of like a middle group of people. Those people really need to think about the decisions that are most likely going to need to be made on behalf of them, right? And what their decision makers are going to face, because it really depends on the medical situation that you're in, whether or not you're likely to recover and how that's going to impact your quality of life. So people who want to continue living, for sure, people who want to maintain quality of life, and then people who value quality of life, who would judge that they're currently living with quality of life that they really wouldn't find acceptable, who want their care focused primarily on comfort. So they would like to stay out of the hospital. They don't want to go to the ICU. They want to stay at home whenever possible. And they're okay with coming if their comfort needs can't be met. So it depends on the person, but those are the three big overall goals of care that every single human is going to fall into one of those goals. So it is something people can do and they can think about ahead of time. It's really, really important because as a doctor, if you tell me what your person's goal is, then I can tell you what care options are going to fall in line with that goal and how the different treatment options are going to impact them potentially going forward.
Okay, so that's really good advice. And so, because as I'm listening to that, I'm thinking, how do I incorporate that into my practice?
Hmm.
For
In the advanced directive, that's what you can do to really help people is define their values and put that information inside of their advanced directive.
okay,
That is extremely helpful to me as a doctor. I have to interpret advanced directives in real time, but so I have to interpret them, right? And this
hmm
is why paramedics can't really interpret advanced directives. They have to use medical order forms, which is a whole nother topic. But if you put in your advanced directive what living means to you and give me a clue as to when you might not want as aggressive medical care based on what quality of life means, then I can help the decision maker navigate the medical situation.
Good.
I, th-
That's good. I'll have to
I
think
think
about how to do that. But yeah,
I can
that's
help you. Let me help you.
I'll be more than happy to let you help me do that. And so
Yeah.
just I think examples, because we could always drop those in, because we change our directives so that we list the things that people may want, like we list them out. We don't tell clients to just write on the lines if you want anything, because they have no idea.
No,
So
yeah.
depending on what they pick in Texas, A or C, then the only thing we're thinking is, medications, IV fluids, nothing else. They just want to go as gently as possible, no life sustaining, if you're terminal or completely incapacitated. So having some extra stuff, I'd love for you to send me that stuff, because I'd
Oh,
love to
yeah.
incorporate it in those directives, because I think that it would be easier for my clients when they're in good shape to make those decisions, because we talk to them about, it's quality of life. How do you see your quality of life? Is this something you want to do? So awesome.
Yeah. And the issue with people living with dementia is that, a lot of times they don't get to update their advanced directive. Once they lose capacity, we typically have an old document, or we don't have a document, and then we're relying on their decision maker. So, yeah. So what I've done is create this program that really helps people kind of be like a living advanced directive for their person living with dementia. But I highly recommend that people put in their value-based, what their values are inside of advanced directives. So I will absolutely send me an email, and I will send you my language that I recommend people use.
Absolutely. But since we're talking about that, so how can families communicate effectively with their medical team knowing good information?
Yeah, so in the hospital, it depends on the situation, right? So I definitely recommend that families, if there's more than one person involved, that they have like a spokesperson, and that they have one point of contact with the hospital. I think asking for meetings is good when you can bring more people together in order to make decisions. I think involving the social work team inside of the hospital and asking for them early to speak with you and understand what's going on with your family. I also think that clearly stating what your expectation is and what you are trying to get out of an ER visit or trying to get out of a hospital stay. Like, just be honest and say, look, like, we are in a situation where it's not safe at home. We really need more help. Like, we were thinking they would go to rehab, because the sooner that you explain what your expectation is, the sooner we can help like whether or not that's something that we can do, and then what other strategies might be able to help you. And that's assuming that whatever healthcare system you're in is a system in which people are still not so burnt out that they're willing to really help. And I know that sometimes people meet resistance with talking to medical professionals, and they feel like they're being treated as a number and not as a human. And so killing staff with kindness is another way to really make a difference for your person. It's like I recognize that you're really busy. Thank you for taking the time out to talk to me. I know you have a lot of patients that you're dealing with. Sometimes just hearing that from a family will make me, I'll just be honest, it will make me stay longer in a room. It will make me make another phone call. The healthcare system is under a lot of stress right now. And I think people that have gone into it for the right reasons. But I think there's a lot of burnout right now. So a little bit of kindness goes a long way.
A little bit of kindness goes a long way everywhere. So,
Yeah.
but definitely, because a lot of people are stressed, and they tend to, because I know anytime I've ever been in the ER, usually your anxiety level is high,
Yeah.
so you're thinking, okay, what do I do? Something's going wrong, so you have a whole lot of stuff running through your brain. So you have to consciously think about, oh, really need to be nice right now.
And we recognize that. We know. I mean, people are not at their best a lot of times when they're in the ER. That's why I try to remind my staff, the other doctors and the nurses, hey, look, like, they're having a really bad day. Like, this is the worst thing that's happened to them in a long time. And like, this is normal for us, So.
Yeah. So we talked about directives and some things we can do from there. But what should someone look for when they're choosing that medical power of attorney, that agent, the person that's going to be making those medical decisions, as far as qualities and things like that? Because normally when I talk to a client about who do you want to make medical decisions for you, my conversation is, they're going to have to make medical decisions. We can only do one at a time, because we do not want the kids fighting in the ER over, if you can't agree. And there has to be somebody that can make hard decisions, when they have to. And so, and I've had to do it. And so I understand, what it takes. But the irony of when I had to do it, it was easy.
Mm.
Because I already knew. I mean, I
Mm-hmm.
already knew,
Mm.
so it made it real super easy for me. And it was a very, ironically enough, it was an end of life decision for my grandfather,
Mm.
I knew he was dying, so there was no reason to do anything else, so
Mm.
it was very calming to have to make that decision, but what should I be telling my clients when they're thinking about choosing someone?
Yeah. I think it's important that they're able to have like open, real, deep conversations about themselves and about their values with this person. That the person's not going to shy away from talking about hard things like, well, what if I am in a situation where I can't communicate or anymore, or I can't move part of my body, I've had a big stroke, or I'm at the end of my life, And if I'm living with dementia, it's every medical decision matters. It's not just end of life. It's so important that they realize that they're going to need to be involved in protecting and advocating and speaking for this person the whole way through, because people lose capacity much, much sooner than people realize. So it has to be someone that you can talk to, like really talk to, that's not going to shy away from these conversations. And it has to be somebody who is willing to speak on your behalf and to put aside their own beliefs and values to actually be your voice. So sometimes we don't always agree with the decisions that someone would want. So it has to be somebody who's willing to set aside that. It has to be someone who can handle stress and hard times, right? Like if somebody really struggles in emotional moments or really stressful moments, they may not be the best decision maker for you. If somebody's extremely emotionally attached to you, they may not be the best medical decision maker for you. It doesn't have to be a family member either. So as long as it's well documented, which is where what you do is so important. As long as it's well documented, it can be your best friend or a cousin, cousin's blood related, but your best friend, a close neighbor, like doesn't have to be a family member. So those are some of the big things. It's like willing to speak as your voice and willing to talk to you, because if you're not willing to have these conversations, how are you going to know? Like you said, like you knew what to do because you knew what your grandfather would want. And so
Yeah.
if you don't know, it makes it so much harder to be a decision maker.
I laugh and tell most clients we talk about everything in my family, and we have for years, usually at the kitchen table
Yeah.
over a meal, so there's never been any really big secrets about how we all want to be taken care of, because my grandmother took care of her mom, I took care of my grandparents, so we've been a very big caregiving type family, so no
Mhm.
big surprise there. So, but how do
Yeah.
you help families prepare? What do you do in your practice now?
Yeah, so I'm still working in the ER, but I have online resources for people on my website, a blog, and an audio training that tells them the steps that you really need to go through in order to be someone's medical decision maker. That's a free training. But I built a program, and basically it's all things medical decision making and dementia. So it teaches them the conditions people are at most at risk for because they're living with dementia, but because they're also someone who is a human being who's aging. So I explain, like, what do we do if someone has a stroke normally? And then how could that care be different for a person living with dementia? And I teach that type of thing for all the different conditions people need to know about. I personally review their person's medical story, their history, and the decision maker's kind of situation to help them figure out the decisions that they're most likely going to have to make based on their person's medical risk. So I look at all that and analyze it and then point them back to the program. Like, these are the lessons and videos that you need to really watch. But part of it also is setting your person's goal of care. So how do you know which way to go? How do you communicate with the medical care team? Like, what questions you need to ask in each moment. And so it's really like a one-stop shop for people who are making medical decisions or will be on behalf of a person living with dementia from the time they're diagnosed all the way till end of life. So it's called Make Your Plan with Dr. Lamb. Yeah, and you can find it on my website. But I recommend people connect with me via email and get to know me a little bit. And then that you can go to blammd.com/email to sign up to communicate with me via email. So,
Perfect. And
yeah.
Doc, this has been really, really good stuff. And I appreciate it immensely because, it's so, it's so necessary for everybody, but it really resonates, with me, with my elder law practice. And so, so I'm looking forward to having my clients, get a taste for all this stuff. And you'll be hearing from me because I really want to know what to put in my directives now. So.
Yeah, I'll send you. I've made this document. I haven't shared it with a lot of people, but I'll send it to you. Just send me an email.
I'm happy to have you send it to me because I just think it's easier for clients. The more you can help them, think about the things and get through the process, it makes it easier for the people coming in afterwards.
Yeah,
So,
it's a gift, this type of planning.
And I think so too. So thanks so much. It's been phenomenal. We look forward to having you on the show again soon.
Anytime.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.